Welcome to the Health Flow Podcast. I'm your host, Jean Armand. Join me weekly as I share health information that will educate and inspire you. Please consider supporting this podcast by listening, subscribing, and rating. You can also support future episodes by making small monthly donations. Once again, welcome to the Health Flow Podcast. Welcome to episode number 36 of the Health Flow Podcast. I have my brother in the house. Cardell's in the house. My brother, one and only. You guys probably already heard me talking about him with the cycling, but he happens to be my guest this week. And we're going to talk about pulmonary embolism. That's right, it hit home. So, Cardell, welcome to episode number 36 of the Health Flow Podcast.
Pleasure to be here.
See, that's just like him, all polite. So, tell me, we want to just learn about your experience. Tell me this, just refresh the audience memory, or just let them know about what happened to you when this pulmonary embolism occur. And actually just start with your symptoms. What were your symptoms?
All right. So as my sister mentioned, I'm a cyclist, right? So I do a lot of long endurance rides. So it's nothing for me to feel aches and pains, especially, as the season progresses. However, I rode on Tuesday. And by the way, this all happened over a span of a week. Had a bike ride on Tuesday. I did about 20 miles with a local group here in New Jersey. The very next day, Wednesday, I started to feel like, maybe I was having back spasms. The other thing that I noticed was my left lower leg below the knee felt like I had a cramp in my lower knee, and it almost kind of felt like I was walking on pins and needles. Got to work, went to urgent care, spoke to the doctor. I want to say he did some x-rays. He didn't really see anything conclusive. He prescribed a muscle relaxer. He also prescribed ibuprofen. So I started taking it. Over the next couple of days, the symptoms didn't really get any worse, but they weren't really getting any better as far as the back spasms were going. That weekend, noticed that walking up 3 or 4 steps in the house was short of breath. Couldn't catch my breath. I was out of breath. That Sunday, I went into the garage and started just doing some stuff in the garage, moving some things around. And again, I felt like I was out of breath and had to sit down and take it easy.
Right.
And this was not like me because, again, I'm in the best shape, as far as being a cyclist goes in September. Again, just continued to kind of bear through the pain. What started to happen, though, was at night, I started to notice that I could not sleep because of the pain. What was happening was I was getting these sharp pains in my chest, in the front part of my chest, as well as my back,
Right.
to the point where it would wake me up and I could not fall asleep. It was almost like it was almost like a stabbing pain.
To your chest and your back.
To my chest and to my back.
Right.
The pain in my leg, it was still there. That wasn't getting any better.
Swollen.
And it started to swell.
Okay.
My leg started to swell. Monday, I decided, I had an event on Monday, a charity event. I was doing a lot of sitting. So again, it wasn't really stressful on Monday. I started to stand when I got uncomfortable, but I kind of, bear through with it, just to kind of get through, just to kind of push through. Because again, I'm giving myself time
to
recover because I'm thinking it's just soreness or some achiness or something.
So let's back up a little bit. I'm not going to say exactly how old you are, but you're in your 50s.
Yep,
You're in good health.
absolutely.
No diagnosed medical problems. You don't take medications for any reason. You're not overweight. You have no predisposition for to even have a blood clot. You didn't even you didn't do any long traveling. You didn't
Nope,
have any recent travels, recent surgeries,
nope,
and you don't live a lifestyle that you're sitting every single day. There's no, and we have no family history of blood clots.
correct.
Okay. You're just healthy.
I am absolutely healthy.
Right.
Um,
When this happened last September,
correct,
less than a year.
correct.
Okay.
So Monday night, I go to bed, and the pain became so severe as I tried to go to sleep Monday night into Tuesday morning
Mm-hmm.
that I got up, found an urgent care nearby where I lived, called out of work, and I said, okay, something is wrong. I don't know what it is, because this should not last as long as it's lasting. So
Right.
I went to urgent care, saw the doctor. The doctor asked me some questions. The doctor said it was one of two things. Either I have a DVT, blood clot, or it could be gallstones or gallbladder.
Right.
But based on what I told her, she said she's not taking any chances. She's writing me a script to go directly to the emergency room.
Exactly.
And so that's what I did. Um,
Exactly.
Went to the emergency room. They took it seriously. So, I was immediately, given several tests. They did a CT scan, and they also did, I think it's called an ultrasound.
Mm-hmm. Yes.
Um, just checking the vein, my leg, and also my lungs. And I'm sitting there, and the doctor comes in, and at this point, I think they have me on oxygen. And the doctor told me that I have not only I have a blood clot in my left leg, and it has traveled up to my lungs, and the blood clot in my lungs are very severe. And the wake up call that I got was the fact that the doctor said this is absolutely something that is life threatening. And I'm sitting there and I'm thinking to myself, how can this be happening to me? I eat right, I exercise, I have no medical history of anything. Why is this happening to me?
Right.
Um, and no answer. And again, that's when they started asking me those questions. Well, did you do X, Y, and Z? And I told them no. So for me, it was a wake up call. It was a wake up call because, again, it doesn't really matter how healthy I was. It doesn't matter how well I took care of myself. This is something that happens regardless of your medical or your health condition. Some of us may be predisposed to it,
Right.
and if you're not, it just could happen just because. And,
Right.
and to this day, the doctor still doesn't really know. They still don't really know what caused it. All we did was, they set me up on a treatment plan, which I'm still currently on right now, which includes, again, blood thinners.
Well, let's go back and talk about
Okay,
your hospital stay.
okay,
So
sure, sure.
they tell you about the blood clot, and just for people, so you can have deep vein thrombosis, a blood clot in your leg.
Yep,
Most people, you find out about it, and it never. A lot of people, they come into the hospital, they have a blood clot in the leg, but it hasn't traveled to the lungs. You could be suspicious. I mean, I thought, I was thinking back of a guy in Atlanta. He was a runner, 46 years old. And I remember coming into the ER and getting a handoff from the other physician, and him telling me, oh, he has a blood clot. um, we're going to give him a prescription and you can just discharge him for me because I don't have time. So I went to the gentleman and I was like, hey, introduced myself and listened and got the story. And I've had more than one cases of this. And I said, hey, how are you? Tell me about what's going on. And he explains. And then he says, but what's so weird is I'm getting chest pain and shortness of breath when I run, and I can't even run a mile. And I usually run 10 miles. He's like, I can't breathe. And then I was like, really? And then it triggered me to say, you know what? This is something else. I'll do that CAT scan like that they did on you. So I ordered the CAT scan, make sure he had it. And to my total shock, he had pulmonary embolism. So years ago, many, many, many people died from pulmonary embolism and we didn't know. You just didn't know what they died from. They had, whether, they could have had trauma, they could have surgery, or they could have just randomly. I even remember all the way back in college, a young girl who died after a car accident, like a week after a car accident that wasn't severe. And I believe at this time, from what we know now in medicine and how we're able to diagnose things, she had a blood clot. Women given childbirth, they have, like fat embolism. They throw a clot of fat, you know, after childbirth, or even blood clots. So yes, sometimes some people are predisposed to it. There's some specific reason you may have it. Like I said, after surgery, where because your body if you have a long surgery, 6, 8, 12 hours, that's a risk factor. And now that's why when you're in a hospital, they automatically are nowadays giving you prophylaxis, whether it's injections and wearing those compression stockings to prevent it. And long flights, we tell people to move around doing long flights, wear the support hose. But you had none of those. And just family history, still to this day, none of our other 5 siblings, it's 5 of us, my parents, no one that we know of has history of blood clots. So, but anyway, so go back to, they diagnosed you and you're hospitalized. What happened after that?
So I'm there in the hospital. The team of doctors come in and they say, look, at this point, we don't know yet if we're going to have to do a procedure.
Right.
So they wanted to keep me in the hospital for a couple of days, and the reason for that is to just to see whether or not my vital signs are staying stable, or whether or not they're fluctuating, moving around. And I guess because I was in such good shape, even with the clot in my lungs and in my legs, all my vitals remained stable over that 2-day period. So at the end of it all, they all agreed that no, we do not have to do a 6 or 8 hour procedure to try to actually remove the clot.
Right.
They had already started me on blood thinners as soon as I was in there, and I continued blood thinners over the 2 days, and that has continued with the prescription stuff now.
Right. So they started you on heparin.
Yes.
Yeah. So the heparin, is an anticoagulant, the most potential, the most what's the word? Potent anticoagulant that we have, and you only get it while you're in the hospital because, of course, bleeding could be it's something that's monitored, like every 4 to 6 hours they're checking your bleeding time, because it can go too far that you bleed, you can bleed out. So 2 days, what they wanted to do is to make sure that you medically, they can manage you versus doing surgery, which is very risky.
Yep.
To remove those blood clots out of your lungs. Yeah.
And also during that time I was in the hospital, they came and they took blood samples, and kind of after the fact, I I realized what they were doing, with those blood samples. Those were the samples I guess they took to check to see if my blood is maybe prone to clotting.
Yeah.
And so after the fact, I learned that no, my blood was actually not prone to clotting. I did not have certain clotting factors.
Mm-hmm.
So again, I stayed in the hospital for a couple of days, and after they saw that everything was stable, got up, was mobile, and was sent home.
Mm-hmm.
Um, and I took a couple of days before I actually went back to work. Um, and it was kind of slow, slow process to get me back up on my feet again, because again, at this point, my lungs are still tender. I'm still having some of the tenderness in my lungs. Now my leg has continued to swell, and now my leg is to the point where I cannot fit my left leg back into work shoes, casual shoes, and I can barely fit them into sneakers. I actually have to basically keep the laces all the way loose.
Mm-hmm.
So that's kind of what I went back to. And over time, that swelling has gone down. It's over 6 months later, and my left leg is still not 100% back to normal.
Right.
There is still some swelling, but it has gone down dramatically.
Right.
Um, so that's where things are as far as the symptoms are right now.
Right.
Um, over that period of time, I've had monthly doctor's visits. Seeing I guess it's a cardio. Is it a cardio surgeon? Yeah, a
Hematologist.
cardio surgeon and also a hematologist.
Mm-hmm.
And I've continued to see both of them. We had talked about me coming off the blood thinners after 6 months. Now with the pandemic that's going on, my my appointment was canceled, so I'm still on that.
Yeah,
And believe me, I want to get off this thing so bad.
I know.
But again, I'm being patient, because again, things could always be a lot worse.
Right. He's being semi-patient because he's out riding his bike. No. But I just want to, I mean, the take home for this is yes, things can happen even to the most healthiest people out there. But one, you have to listen to your body. If you're not, you know your body, and you're the best. I always say to patients, look, I'm doing the investigation and you have all the answers. So you have to be forthcoming with what's going on. Go seek medical attention when you're not well. You know more than anyone else when you're not feeling well. You know, you're telling us we need you. You've got all the information. So feel free to go in the hospital and or see your doctor to get diagnosed. And I really think, and I know for a fact that you being in good shape is what helped you. Because if to be in your 50s and not being in good shape, your breathing, just the way your body responded would have been totally different. Those patients are usually in ICU, intensive care unit, maybe even on a ventilator. You're just thinking a blood clot, and you had them in both lungs, right?
Yes.
You
Yeah.
had them not just in one. We have two lungs. You had them sitting in the branches. So that means perfusion of oxygenated blood is not going out to your whole body like it should. So that, for me, I know when my sister-in-law called and told me, I was like, oh my God, like, oh my God. I mean, I know that we're capable medically to fix it, but it's like I knew how dangerous it was. So, it was scary, but we just got to be diligent in taking good care of ourselves and going to get medical attention when you need it. Right?
Absolutely.
Anything else you learned about this whole experience that you want to share?
You just can't take life. You can't take life for granted. You
Yeah.
really can't. It was, I mentioned it before, it was a wake up call for me, because I almost kind of felt, to be honest with you, invincible
Mm-hmm.
from a health perspective, just because I knew I was physically in good shape and I was eating right and doing all the things that
Yes.
I'm supposed to be doing.
Right.
And for this to happen and to take me down the way it did,
Yeah.
it was an eye-opening experience. And I've never had this experience before.
Yeah. And we know how you hate hospitals.
Oh, absolutely.
And we know you've only been in the hospital for the birth of your children. And even then it was a struggle.
I was barely there. I was barely there.
This is one person where he walks into the doors of a hospital. He gets pale. He's looking like he's about to fall out, faint. I was there. I saw him at the birth of his first son. Oh my God. I was more scared for him than I was for your wife. Pass out. Lord, help him. So I'm so glad that you're doing fine and that you're alive and well to share this experience. The blood that we didn't mention it, but the blood thinner that you're on now is Xarelto, right?
Yes.
Yeah, and it's just once a day.
It's just once a day. Yeah,
There's no, go ahead.
I was going to say they actually initially, once I left the hospital, they started me out with a stronger dosage, and then slowly they backed that down.
Right, right. And it's because you, so now we'll look at you as someone who had an unprovoked DVT and blood clot. So forever, when you have any if you were to have any surgeries or anything, that's something you should always mention. And they'll definitely take precautions to if you were to ever have surgical procedure. That's like when we're clearing people for surgery, that's like one of those number one things, because it puts you at a higher risk, not necessarily, but we'll be more cautious with the length of a surgery. The anesthesiologist is going to be really watching your oxygenation levels and things like that. So you're not going to have any surgery, so it's a moot point, but just for the education of everyone else. All right, brother dear, thank you for being my guest. I appreciate it.
No problem.
All right,
All right, I'll see you soon.
Yeah, stay healthy in New Jersey. We need you to, are you staying indoors?
Oh, absolutely.
You're practicing social distancing.
I'm trying to do that. I have been out on a bike a couple of times, but again, solo rides.
Okay, excellent, excellent. And you guys are working from home?
Yep.
All right. Thank you. Love you.
I love you too. Bye.
Bye-bye. Thank you for listening to the Health Flow podcast. Your support is much appreciated. It is my goal to share health information that you find helpful. Email topics of interest to thehealthflow@gmail.com. Follow me on Instagram @thehealthflow, also on Facebook @thehealthflow. Don't forget to subscribe, rate, and share. Until next time, keep your health flowing.